Hi, welcome to another edition of This Issue. My guest this time is Dr. Bill Clark, a retired primary care internal medicine doctor who's also an advocate for national single-payer health care. Bill, welcome to the show.
Thanks very much, Bruce.
Great to have you. Why do you want to see a change in the healthcare system in America?
Well, we haven't got much of a system, Bruce. You know, we're all working in little compartments. Our system doesn't produce very consistently the high quality care that we'd like. It's not very just. There are huge inequalities in the system. It doesn't account, it's not a satisfactory marketplace, although people are trying to treat health insurance as if it were a commodity. And it's great. It's heavily politicized. I mean, the non-system has many players working to keep it the way it is, and many Americans are suffering because of the way it is, and it's time for change.
How many Americans today are without any health care coverage at all?
I'll bet you that plenty of people watching this show are without health care coverage, and the total figure is just amazing. 47 million Americans have no health care coverage.
And that's out of a population of 300
million or so.
Million people, yeah. So 1 out of every 6 almost.
Yeah, like 16% is the percent figure. Yeah.
Well, I must say that I'm now one of those people. I had a $15,000 deductible health care plan, but for every year, for the past 4 years or so, Anthem Blue Cross has increased their premiums by about 20%. And so it just got to the point where I couldn't afford it anymore, especially for a policy with $15,000 deductible. So now I have no coverage. So for me, this is a very personal problem. A minute ago, you talked about, you seemed to allude to the fact that there are pressures keeping us from having a national health care. Where's that blockage, that arterial blockage coming from?
The insurance companies have a huge stake in keeping the system the way it is because they're in business to make money. There are many of them. The money to be made is huge, and they have every reason to donate to congressional and other elections to make sure that the system stays the way it is. And they're just half of the political problem or the economic problem. The other half is the drug companies, the pharmaceutical companies, who make enormous profits. Did you know that in Washington, there's more than one lobbyist paid for by the drug companies full-time per congressperson? So that is, you know, there are well over 700 full-time people paid for by your drug money who are lobbying congresspeople to keep the system the way it is.
And what's the incentive for the politicians to continue to listen to them?
Politicians want to get elected. They want to do the right thing. They want to help us all out. They want to run the country. And for them, if they take a strong position that they want to change the system, guess what? Their funding dries up. You know, the money from the pharmaceutical houses and insurance companies goes away. And
it goes to somebody else.
It goes to somebody else. And they get tremendous pressure from the lobbyists to change their positions. You know, it's sort of independent of the money. People keep in their office telling them, do this, do that. And, you know, this would be the right thing for your constituents and stuff like that.
And what's the percentage of Americans today, do you know, that want a national health care system?
I want to make it really clear that we are not talking about socialized medicine here, okay? We're talking about a system that insures everybody, okay? And if you ask Americans whether they'd like a system like that, 65% of Americans consistently say, yes, I would like a system like that. If you ask Canadians who have a system like that, whether they'd like to switch to a free enterprise system like ours, 3% of Canadians say they'd like to change. That's the same as their illiteracy rate, by the way.
So they're pretty happy with what they have.
They're very happy with what they have.
Well, in fact, the system we have in America today this multi-million dollar, billion-dollar web of health insurance corporations that covers everybody but 47 million Americans. It costs twice as much what the other industrialized countries are paying, but at the same time, our life expectancy is lower in the United States, and our infant mortality rate is higher than countries like Canada, Britain, and Germany. So why is this? We're spending more than these other countries, but we're not getting nearly the quality, if you will, that these other countries are getting.
When the CEO of WellPoint, a large insurance company, makes several $million, okay, and is awarded bonuses in the hundreds of millions for successful mergers with other insurance companies, getting bigger and bigger. When it costs 13% or so of premiums for administrative activity in the insurance industry.
Each premium that a person pays, 13% of their premium goes for administration?
Another 10% or so goes to profits and advertising. So somewhere around 75% of the healthcare dollar that goes through an insurance company pays for healthcare. And the rest is inflated salaries, advertising, and administrative costs, which are huge because those companies have to. The only way an insurance company can stay in business in a highly competitive market is to find ways to insure people who are less likely to use medical care. So every insurance company has one system or another for finding the healthy people to insure, which is not what insurance is about.
Yeah.
Insurance is about we each pay our little bit, and then when it's our turn to be sick, we get the benefit, and we help each other out. And that's an insurance plan. That isn't the way it's working in this country.
It's like a rigged game then. They're clearing out the people that are using the system, so they're clearing them out so that their profits increase. So it's all about making money more than really providing health care.
In corporate America, that's what it's about. I mean, corporations are out there to make money, and I'm not a foe of making money or having corporations. It's just that the healthcare corporations, the insurance companies, have gotten bigger and bigger and bigger and more power, and it's driving our system, our non-system, in totally improper directions and not taking care of us.
My own personal doctor, when I had a physical about 2 years ago, we got talking about this subject, and he told me that every single patient he has, he said, I don't care what level of income they are, what they do for a living, every patient I have, he said, wants national health care. And he was, a very strong advocate for it. Do you think most doctors are in favor of national health care, or is there a lot of doctors that are keeping us from moving in this direction?
I want to go back one step and say, be careful about saying national health care, because people keep thinking, oh, they mean socialized medicine. They mean the government's going to run things. And we are not talking about that. We are talking about arranging a system like Medicare, where we all pay in, and some single payer, like the government, that's the natural one, pays the fees and so on that are generated. We still get choice of doctor, which is the key thing. We don't get choice of health insurance, but we get choice of doctor. That's what people really care about. So we're talking about a system that would cover everybody, and that would greatly diminish administrative costs by having a single payer. To go back to your question, Physicians for a National Health Program, of which I'm a member, has well over 15,000 members, of physicians who are strong advocates of this. The American College of Physicians, the second largest organized professional group of physicians in this country, 125,000 members, recently put out a statement saying we're in favor of single-payer coverage. And in a survey that the American Medical Association did a couple of years ago, 54%, or was it 45? A very large percentage of physicians said, yes, I'm in favor of a single-payer system, which is organized and simple and doesn't cost me 50% of what I take to pay employees to be hassled by insurance companies and write paper.
Tell us a personal story from your own time as a primary care internal medicine physician. You recently retired, but you worked as a doctor for how many years?
I worked my entire professional career, 35 years or so.
Okay. So tell us a personal story about some of the frustrations of dealing with these insurance companies, whether it's paperwork or fighting authorization for treatment or disputing claims, something like that. Give the viewer some sense of what it's like to deal with all that.
It's just a bureaucratic hell. Every company has their own forms. They have their own rules. And you go nuts trying to get care for a particular patient because you can't keep track of all the insurance company's rules, what they will and won't cover. You can't possibly know if a patient asks how much of this $3,000 procedure they are going to have to pay for personally, their deductibles and all that co-insurance stuff. And we had to have 2 employees for every doctor in my practice so that we could always have somebody on the telephone talking to insurance companies about, can we please do this procedure, which is absolutely necessary, but you want us to certify that it's necessary before you'll pay for it.
So you had to have someone full-time just doing that job as a sort of liaison between you and the insurance company, getting approval for you to carry out your medical decisions.
Exactly.
Now, some people, one of the criticisms of so-called national health care or single-payer health care, they say that, well, it'll take the doctor out of the loop, and in fact, the doctor's not in the loop now, then you're saying. Is that right?
Yeah, that's exactly right. Right now, it's a system where the doctor has to fight to be in the loop. If you speak to physicians in Canada or in any other developed country, we are the only one without a single-payer universal coverage system. The only one of all developed nations that does not have such a system. If you talk to doctors in those countries, they love what they're doing. They get to deliver medical care most of the time. They are not running businesses. They are not fussing with 65,000 forms. There's a pretty standard form. They take care of it and so on. In Michael Moore's film, Sicko, he interviewed physicians from several countries, and as the physician in Britain said, well, we're not rich like CEOs, but we're doing fine. We get a decent salary, I have a very good lifestyle, 2 cars, and I get to do medical care. Yeah. I don't have to do a business.
Yeah.
I'm ready.
You're ready.
I was ready before I quit practice.
And what are you doing these days now that you're semi-retired or whatever?
Yeah, I've been long interested in physician-patient relationships and communication issues. It's not easy to tell people they have cancer, or to say your cancer, there are no more treatments that are available for your cancer, or to say, I really think you have a serious drinking problem. And it takes a little skill to do that. So I'm interested in teaching about those skills, relationship and communication, and very actively involved with a national and, in fact, international group who supports that kind of activity.
And then in addition, you're also active trying to bring about this idea of single-payer universal health care. Talk about a little bit more specifically about what that would look like. I've heard you use the word Medicare for all,
right,
but not everybody even understands what Medicare is. So describe in general what all that really means, your vision, the vision of your organization for the future of healthcare in America.
Here's my story. When I turned 65, I had already retired. I was paying COBRA rates for my health insurance after I retired. And I was paying. When I turned 65, I breathed a big sigh of relief. I said, whoa, I'm covered by Medicare from now on. And if you talk to people over 65, that's what they say. It ain't perfect. No system is perfect. But by golly, I just don't have to worry the way I had to before about whether I'm covered or whether this or that will be covered or whatever. It's a straightforward, equitable system that,
the government runs Medicare.
Right.
And what's the administrative cost of Medicare?
It costs around 3% of what you pay, of what is paid, what is collected, the total money to run Medicare.
In comparison to insurance companies, on average, what's their
13?
13.
Yeah, so it's
highly efficient.
It's about 3 times more efficient.
So highly efficient for a government program, right?
Absolutely. Some people have argued, well, it doesn't count the cost of running the whole government, of which Medicare is just a little part. But even if you make all the adjustments you want to make, it's still way, way more efficient than any corporation. Well, I mean, one factor to note is that the average pay of a CEO for an insurance company is 2,000 times higher than the lower paid people in insurance companies. And in government, it's much less than that. I have the numbers, but it's something like 50 to 1, not 2,000 to 1. You know, so we're just not paying those huge salaries at the top to the people who run Medicare. And we're paying them a decent living.
And when you have a ton of insurance companies, there's all kinds of duplication then in these CEO salaries and offices and buildings and administration and copy machines. Yeah. And so the person getting the insurance is paying over and over again this duplication that is just wasted money, right?
Yeah. And you left out the advertising.
Yeah.
I mean, it's just a huge expense to try to compete for patients to sign up for your insurance plan. And, you know, it worked for a while, maybe 50 years ago, but it's not working now. And all the tweaks and trials that have happened over the past 30 years since people have been noticing that this is a serious problem have failed to improve quality and have failed to control costs. And the number of people who have no coverage whatsoever has gone up and up and up.
You said there are 46, 47 million Americans now without health care.
We have an unjust system. And, you know, this country was founded on principles of justice and equality and fairness. And the healthcare system is one of the places where it's really gone sour.
Is healthcare a human right?
I like to think of it that way. Absolutely. You know, it should be in any developed country a right. Do you know what? Cuba has a lower infant mortality than this country does. Cuba has higher health standards than this country.
That's saying something, isn't it?
It's saying something. You know, we're number 42, I think, in infant mortality, just ahead of Mozambique. Think about it. It's nuts.
I'm talking to Dr. Bill Clark, who's a retired primary care internal medicine physician and who is an advocate for a universal single-payer healthcare system. Bill, let's talk about the upcoming elections, the presidential primaries that are now underway. Let's look at the Democrats because we know the Republicans are totally opposed to any real development of health care for people. But the Democrats are all saying they have a national health care plan. Obama, Hillary Clinton, you know, they're all saying that they have these plans. Can you quickly give me some critique of what they're saying?
Sure. Republicans are saying let's let the private system take care of it, and it's pretty clear that it hasn't taken care of it over the past 30 years, and it's not going to take care of it. Okay. The Democrats are saying a little bit more like, let's have a mandate that everybody will get coverage, affordable coverage. Hillary Clinton says that. Edwards says that. Obama doesn't. He just says that we will find ways to make insurance affordable. But none of them have any plans to control costs, so the costs will continue to go up. All of them want to use the current private system of insurance and, you know, support the insurance companies. I mean, that's, well, so they leave us with the same system. Dennis Kucinich is
Well,
the
let
only...
me, before you go,
Yeah.
when you say they want to mandate coverage,
Yeah.
that to me sounds a little bit like automobile insurance.
Yeah.
That the law mandates or requires you and I to have automobile insurance. Are they saying that we should pass a law that requires everyone to buy health care?
Yeah, like Massachusetts.
Well, how can you afford that, though? That's the problem. I couldn't afford it, so I had to drop out.
Listen to the numbers. In Massachusetts, 7%, they've had a program going for 2 years now, 7% of the 245,000 uninsured people are now insured. You know, it's a minuscule gain that has been made because people cannot afford to buy the policies.
But they're talking about penalizing people that don't sign up, right?
If you're an employer who doesn't sign up, you get a fine, $300. If you're an individual who doesn't buy insurance, there's a $2,000 fine for not buying insurance in the state of Massachusetts.
And how could that be? If I had $2,000, I'd buy the insurance.
Do you think they're going to enforce this?
They're not.
I mean, it's nuts. And that's it's this kind of a system that all the presidential candidates, exception Kucinich, are promoting.
Okay, so you're saying Dennis Kucinich from Ohio, the congressman from Ohio, he's got a different plan. What is his plan?
His plan is thoroughly outlined in House Resolution 676. Okay, it's before the Congress and has been there since 2005. The Republicans wouldn't even look at it when they were in charge, and the Democrats are not pushing it out of committee. It's in committee, and it was probably going to stay there because of factors we've talked about before with the political system. But basically, it's Medicare for all. It says we got the money in the system at the present time. We are spending enough money to provide health care insurance, good insurance, for every single American that would cover your eyeglasses, your teeth, your mental health, preventive services, the whole shebang for every American, and would probably cover, when this was first investigated in 2003, it definitely would have covered long-term care as well. I'm not sure whether that's still the case. But in any case, we are spending enough money to cover every American if we funnel it through a single-payer system like Medicare for everybody.
And the main congressional delegation, Olympia Snowe, Susan Collins, Tom Allen, Mike Michaud, where do they come down on that bill there that would lay that out for us?
There are 80 sponsors of House Resolution 676. Michaud and Allen are not sponsors. Okay, I've written to Tom Allen many times. He's my congressperson. And I get back some of the same old. You know, we're not going to make radical changes in the system.
Why does Tom Allen take that position?
He doesn't exactly say why he takes that position. He thinks that, no, what he says is the tweaking will fix the system. You know, we'll find ways to control costs and make insurance affordable for everyone.
And what do you say to that?
And I say, we've been working on that for at least 30 years, more like 50. It has not worked so far. All the evidence shows that it will not work. Every state, not every, 25 states have tried systems, including the state of Maine. Maine got courageous and put up Dorigo, and I was so much in favor of that. There are so many forces at work that constrain Dorigo that it has not succeeded in covering more than a few percent of the uninsured Mainers up to this time. And as you know from the newspapers, it's foundering money-wise. The same thing has happened in California and in many other states who've tried to say, we think we need to do something about this.
So in the upcoming Senate race, Susan Collins, Tom Allen, I like to call him Tom Collins, on health care, they're going to be pretty much in the same place, aren't they?
They're going to say, I support a plan that would provide affordable coverage for every American, right? Yeah, so do you know that at the present time, if you're working full-time in a low-wage job and you don't have insurance because it's a job that doesn't give you insurance, but it gives you a small living, you're not eligible for Medicaid. So your kids can't get covered through a system. And the president vetoed the plan, the CHIP plan, that would have increased opportunities to cover kids, at least, when their parents were not eligible for insurance. I mean, we're going nowhere with this.
Well, what do we do? How does the public respond when we have this corporate, essentially, blockage of any real change in the healthcare system of America? We have politicians, by and large, that will not support bills like the Kucinich bill that will bring forward universal national single-payer health care. How does the public then react? How does the public make this change?
Mm-hmm.
Because this is really about helping ourselves here. Yeah. What do we do?
You bet it is. It's, the simplest thing is to write your congressperson and keep writing, okay? And I know it sounds like, whoa, gosh, nothing has happened, but that's the only way they know what we want as citizens. It's not the only way. The other way, the second way, is to make groups, is to get people together and then start talking to congresspeople as groups. The Physicians for a National Health Plan could use support. Encourage your doctor to join this group of physicians who single-mindedly are supporting this particular thing. Talk to your physicians. They want things changed. Your doctors know what a mess this is. Okay? Talk to them.
So maybe the PTA needs to start talking about it. Maybe we need to go to the town council and have them pass a resolution. Things like that, right?
Things like that. Make a difference.
We need to start taking it out into the community, bring the issue into a wider part of the community.
And people who are the haves, I still have insurance. I'm on Medicare, okay? People like me and many of you out there who are covered by insurance need to take the lead. I mean, we have to recognize that it could be us.
Show some solidarity.
Show some solidarity.
With people like me on the other side of the table that don't have health care now.
And lots of other people who are a little less like you in their activism. People who have crummy jobs or no jobs and no insurance are not about to go out there and write letters. And many of them don't even vote. They feel terribly depressed and disempowered. It's up to us who do have the opportunity to pressure the people that run things, our congresspeople, and to say, look, this has to change. It's unjust. It's unfair. It's not the way the principles this country was founded on. We can do better. Much of the world knows how to do it. We should do it. And as I said, presidential candidate Kucinich, along with 80 other congresspeople, say, we think we know how to do this. Medicare for everybody would do it. And
so when in the next election, when Tom Collins comes around asking for our vote, we need to be really hitting both of them, Susan Collins and Tom Allen, hard on this issue, saying that we understand both of you are lacking on this health care issue.
Absolutely.
It's not a Republican or Democrat thing. They're both lacking here.
This is not a partisan issue.
Well, thank you so much, Bill Clark, for your work, for your passion, for being one of the comfortable who's out there speaking on behalf of those who need help when it comes to the healthcare issue. I wish you the best of luck with it, and I wish more people that do have health insurance were speaking out as strongly on behalf of those of us who don't. And thank you for watching another edition of This Issue. Until next time, good luck to you all, and please get organized.